Good afternoon, everyone. I'm Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. More than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic. But the most important part is not to ignore it, and doing self medication can worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early revision. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us Dr. Kirti Kalra, live from Dr. Kalra's clinic, Karnal, who will educate us more about urticaria and its management. Dr. Kirti is a ex-senior resident NHL Medical College, Ahmedabad, and ex-senior resident KCGMC, Karnal. Dr. Kirti Kalra completed her MBBS, MD, DNB, Skin and VD, clinical and cosmetic dermatologist from the University of Health Sciences, Rohtak. A very warm welcome to you, Dr. Kirti Kalra. Hope you are doing good, ma'am.
Yeah, hello everyone. I've been rightly introduced by our host, and a warm thank you to all of you for having me here and giving me this opportunity. So yes, we can start our session as soon as possible.
Definitely, doctor. Without wasting any time, we'll start our session as we are talking about a very important thing that is urticaria and its management. But before we start, doctor, first of all, we would like to understand what is urticaria. Urticaria आखिर होता क्या है?
Okay. Yeah. Urticaria is a very common condition which we usually see in our clinical practice. It is basically wheals or hives in a common man language. Wheals and hive, which are erythematous rashes which come upon your skin suddenly. It's a sudden onset disease mostly. Some people are having acute onsets of urticaria associated with swelling over eyes, their lips, and around ears, and with bumps. In a common language, we call it red bumps all over the body suddenly after taking some medications or food, or sometimes it is spontaneous as well. So you can very well see in your surroundings that people are having such kind of problems very often. So this is basically the red erythematous rashes which come up suddenly over your skin.
As you said that these raised bumps can be due to medication or food or anything else, we would like to discuss it in a bit of detail that what can cause urticaria, what can trigger urticaria.
See, many causes are there. Urticaria has a wide range of causes. Like, first of all, foremost, sometimes there is no cause. Then we call it idiopathic. जब कोई cause ही हमें समझ नहीं आ रहा, there is no reason other than what I will tell you later on. Next, when we have certain causes, like most commonly food, there are certain food items like eggs, nuts, soybean, sometimes milk products. It varies from person to person. You cannot streamline the whole thing for every patient ki sabhi patient ko ek hi cheez se urticaria ho raha hai. Every person has a different scenario of getting urticaria for certain foods. Kuch logo ko sirf milk products se, dairy products se urticaria hota hai, बाकी soya से नहीं हुआ, egg से. I'm just talking about the common food items which we generally see जिनसे ऐसा urticaria होता है. Like when we talk about non-veg, shellfish, prawns, they're very common causes of getting angioedemas in our practice. Then another thing is, apart from food, we see certain medications which can cause sudden onset of such kind of rashes, like any sort of antibiotic. I mean, most common we see through certain painkillers which cause urticaria. जो painkillers हम routine daily usage में लेते ही हैं, कई बार उनकी वजह से भी urticaria देखने मिलता है. Then, apart from these, there are certain inducible urticarias. Inducible urticarias are those which are induced by certain triggers, specific triggers. Like apart from food and medications, there are certain other triggers as well, like aquagenic urticaria, like water induced. कभी आपने shower लिया, कुछ लोगों का ऐसा history होता है, just after a shower they get such kind of urticarial rashes, or after sweating, which is called cholinergic urticaria, sweat induced urticaria. Like after you did your exercises and people are tendency of having developing urticaria, that is called cholinergic urticaria. Then one is solar urticaria, like sun rays. When you go out on beaches or some mountain areas where sun rays are direct, you get urticaria. Then another such kind of inducible urticaria is a pressure urticaria, which is very difficult to find out. Sometimes people are having urticaria and the cause is they are having a tight belt around their waist. I'm not saying this is a very common cause. You have to rule out such causes, that whether it is an inducible urticaria or other like other factors are associated with urticaria. Then apart from that, we see, as I told you before, idiopathic urticaria, which is commonly seen. So these are all these causes, like food, medications, inducible urticarias, or another spontaneous, like idiopathic urticaria. These are the common causes.
With what you said, doctor, I can say that n number of causes are responsible. Anything and everything can cause urticaria. Right. Yeah, and many a times, as you said, the cause or the reason is even untraceable.
Many times.
Right. And as you said, urticaria are rashes, raised rashes rather, and they are red in color. But still, because what happens many times, because people generally have skin allergies or skin rashes, and for them as a layman, it's many times tough to identify or distinguish between a normal rash and urticaria. तो हम ये भी आपसे जानना चाहेंगे थोड़े डिटेल में डॉक्टर की अर्टिकेरिया कैसे दिखता है एग्जैक्टली। हालांकि ये इस पर हम पहले बात कर चुके हैं, पर थोड़ा लेंथ में बात करना चाहेंगे ताकि आम लोग भी, हमारे जो व्यूअर्स हैं, वो भी ये समझ सके कि जो उनको हो रहा है कहीं वो अर्टिकेरिया तो नहीं।
See, urticaria is basically of a condition. हम हिंदी में इसके बारे में बात करते हैं ताकि आप अच्छे से भी समझ पाए और हमारे व्यूवर्स भी अच्छे से समझ पाए। जब कुछ लोग अपनी कॉमन नॉर्थ इंडिया में यूजुअली होता है कि लोगों को दाफड़ आ जाना, सो दाफड़ आ जाना या लाल रंग के चकत्ते हो जाना, लोगों की ऐसी हिस्ट्री होती है कि सडनली उन्होंने कुछ खाया, 1 घंटे बाद उनको इस लाल रंग के मोटे मोटे से चकत्ते आने लगे और एसोसिएटेड विद इंटेंस इचिंग इतनी ज्यादा दैट इज अनबियरेबल। समटाइम्स इन चकत्तों के साथ, जिसे हम अर्टिकेरिया कहते हैं, वी सी सर्टेन एरियाज ऑफ स्वेलिंग, लाइक स्वेलिंग अराउंड योर आईज, योर नोज, योर ईयर लोब्यूल्स, योर लिप्स एंड सर्टेन बॉडी एरियाज। तो हम उसे एंजियोइडिमा बोलते हैं कि कुछ लोगों को अर्टिकेरिया तो हुआ ही, लाल रंग के चकत्ते आए जो कि रेज्ड हैं, रेड हैं, हाईली इची हैं, associated with swelling over certain areas, तो उसे हम एंजियोइडिमा associated with urticaria बोलते हैं। इस कंडीशन में हमें थोड़ा और ज्यादा केयरफुल रहना चाहिए, बिकॉज ऐसी कंडीशन में कई बार हमारे गले के अंदर की जो म्यूकोजा है, जिसे हम लारिंजियल एडिमा बोलते हैं, वो हो जाता है, जिसकी वजह से हमें सांस लेने में या बोलने में भी तकलीफ होने लगती है। Sometimes angioedema is not there and urticaria is the only condition कि आपको सिर्फ बॉडी पे multiple red bumps, जैसा कि मैंने बोला, लाल रंग के दाफड़ होने लगे। और sometimes this urticaria is associated with angioedema, जिसमें आपको swelling over your certain body areas as well as internal tissues होती है, जिसमें हमें सांस लेने में तकलीफ या बोलने में तकलीफ या खाना खाना अटक जाना, इस तरीके की तकलीफ होती है। तो ये एक कॉमन प्रेजेंटेशन है अर्टिकेरिया की। Sometimes there is a triggering factor, as we have discussed before, कि आपने कुछ चीज खाई या medication ली and suddenly there is development of rash all over your body within half an hour of taking that food or the triggering agent, और वो इतनी इस itching के साथ मतलब प्रेजेंट करेगा और वो इतना रेड होगा, आप एकदम मतलब एरिदिमा ओवर योर फेस गेट्स रेडेंड और स्वोलन, तो आपको मतलब कंट्रोल ही नहीं होता, यू जस्ट टू इंटेंस इचिंग एसोसिएटेड विद दैट, और वो 1-1.5 घंटा रहता है और वो अपने आप चला जाता है। कई बार वो 1-1.5 घंटे बाद भी नहीं जाता, तो हमें मेडिकेशंस ले लेनी चाहिए ताकि हमारा जो और ज्यादा सिवियर या फिर हम उसे नहीं सहन कर पाते, तो हमें मेडिकेशन लेने के बाद वो अर्टिकेरिया चला जाता है। दूसरी चीज, कई बार इसी तरीके का रैश 24 घंटे से ज्यादा रहता है, तब हमें दूसरे तरीके की चीजें लाइक वैस्कुलाइटिस, जिसे हम अर्टिकेरियल वैस्कुलाइटिस बोलते हैं, वो चीज जरूर रूल आउट करनी चाहिए, क्योंकि दैट इज अ लिटिल डिफरेंट कंडीशन फ्रॉम कॉमन अर्टिकेरिया व्हिच वी आर टॉकिंग अबाउट। जो अर्टिकेरिया है यूजुअली मैक्सिमम 12 आवर्स और 24 आवर्स तक चला जाता है, मतलब विद इन 24 आवर्स इट शुड सबसाइड, ईदर विद मेडिकेशन, या तो मेडिसिन के साथ या फिर विदाउट मेडिकेशन। इससे लंबा नहीं रहना चाहिए। अगर वो इससे लंबा रहता है तो वी शुड रूल आउट सम अदर कॉजेज व्हिच आर वेरी इंपॉर्टेंट फॉर us to rule out. Yeah.
Right. Now, after you have explained it so well that you know how does it look like and even about angioedema, doctor, we would like to know, is urticaria a serious disease?
Urticaria is a serious disease at times when it is when it is causing internal edema over your mucosal sites, like when it is associated with angioedema, like laryngeal edema, eye edema. At that time, it becomes a serious condition because people become breathless at that time. You have difficulty in breathing or swallowing, and speech becomes hampered. So that is, you have to take emergency treatment immediately at that point. So there is a very thin line. Sometimes there is just small rash over your body and you take your medication, then it's gone, nothing. But sometimes it is associated with edema over your internal organs, then it becomes a serious problem. You have to take your treatment in an emergency. So yes, right. You should take it seriously and you should get it treated because it's a treatable condition. It's not something which cannot be treated. So why to hamper your quality of life?
Exactly. You said a very valuable thing. Why to hamper the quality of life? Because what happens, especially with the people who are suffering from urticaria, they keep on suffering in silence. They won't come up and tell people that, see, I have a condition, I need to go and seek advice from an expert, which could be a qualified dermatologist. But they keep on suffering. Itching, I can imagine, can be so frustrating and stressful for the patients.
Yeah, that is important.
Yes. And as you said, it could become serious if it's like angioedema. So it's important that people are aware about it. ये पूरा सेशन करने का हमारा मकसद ही यही है कि हम लोगों को अवेयर कर सके कि अर्टिकेरिया क्या है, किस तरह से इसका मैनेजमेंट पॉसिबल है, ताकि आपको पता रहे कि अगर ये हो रहा है तो आपको क्या करना है, कहाँ जाना है। शॉर्ट में बता सकते हैं, क्वालिफाइड डर्मेटोलॉजिस्ट के पास आपको जाना है, बाकी बात थ्रू आउट इस सेशन में हम कर ही रहे हैं। Now, doctor, as initially I said that urticaria can be classified in acute and chronic. We would like you to shed some more light on that.
Yeah. See, one is acute urticaria and another is, this is a classification which is done on the basis of duration of disease. मतलब आपको disease का duration कितने समय से है. One is acute urticaria and another is chronic urticaria. When it is acute urticaria, the duration of disease, I mean, your first incidence of getting urticaria is less than, until date is less than 6 weeks. अभी 6 हफ्ते से कम हुआ है, we label it as acute urticaria, and if it is more than 6 weeks, we call it as chronic urticaria. And one more thing is, sometimes like in children we see there is some sort of infection and थोड़ा फीवर हुआ, 2 हफ्ते बाद बच्चे को अर्टिकेरिया होने लगा. So in children usually we see, I mean according to the age group, we see acute urticarias which subside with proper medication, like you treat the infection, that can be the triggering cause in children, and it's gone. In children, we see mostly acute urticarias, but yes, in adults, we see chronic spontaneous urticaria, which is chronic more than 6 months, and other associated diseases are as well. In fact, in causes, I forgot to tell you that infection can also be one of the causes of urticaria. So in children, we have to definitely rule out infection, which is the most common cause in children. Other associated diseases like thyroid and also are there, which have to be ruled out. Yeah.
Right. We would also like to know what are the potential complications of urticaria if left untreated.
See, first and foremost, as I told you before, if left untreated and if it is associated with angioedema, it can be life-threatening. And there is a very thin line between like angioedema or anaphylaxis, then which have to be properly taken care of. That is the first important thing. Another complication with urticaria which we usually see is, actually people have a very poor quality of life when they have a chronic urticaria, because they keep under anxiety all the time, and sometimes people are facing the issues with dysthymia or depression because they are having urticaria continuously. I mean, there are certain patients which do not get response to medications at times. Then we have to definitely go for higher level of treatment for such patient. So quality of life is totally hampered in such type of chronic patients of urticaria. Another thing which we see in our patients is sometimes urticaria is the only presentation and there is no underlying cause which we can see. Then we have to rule out another endocrinological conditions like thyroid and diabetes, and sometimes they are incidental findings. आप urticaria के लिए आते हैं, आपको presentation यही है, but actually after diagnosis that the condition comes out to be patient has thyroid. So वो चीज भी हमें treat करना पड़ता है कि मतलब patient को हमें guide करना पड़ता है कि the main condition was thyroid and you were getting urticaria because of that. So this is not a basically complication. This is an incidental finding which come up with urticaria. Yeah.
Right. And doctor, as nowadays we are so aware about, things, just every information is there in a single click. Now, what normally people do whenever they have urticaria or any other kind of allergy, they'll go to their nearby chemist shop, ask for an anti-allergen, and that's it. फिर अगर फिर से complications हो रहा है, फिर से जाएंगे anti-allergen खा लेंगे and good to go. What's your take on that?
See, as I told you, there are causes for urticaria. If you're not ruling out the causes, what is the actual cause, the cycle will remain the same. You will have an urticaria, will take an over-the-counter medication, chemist से लिया, दवाई ठीक हो गए, 4 दिन बाद फिर से urticaria है. So important thing is first get your cause ruled out if you are having urticaria. Sometimes, as I told you, there are no plausible reasons and people are getting spontaneous urticaria. Still, then we also have treatment for chronic spontaneous urticaria. There is a ladder of treatment according to which it is managed. So over-the-counter drugs lena is not a solution for this. It's just a temp thing to get a relief for an hour or so, for a day or so. But पूरी life हम इस तरीके से नहीं निकाल सकते without ruling out the cause.
Right. और क्या हम self medication अगर करते रहे, जैसा कि आपने बताया एक दिन दवाई ली, ठीक लगने लगा, फिर हमने बंद कर दिया, डॉक्टर को नहीं दिखा रहे हैं और फिर प्रॉब्लम हुई, फिर हमने दवाई ले ली, फिर ठीक हो गया. लेकिन क्या इस तरह से अगर हम इग्नोर करते रहे या एडवाइस नहीं लिए क्वालिफाइड डर्मेटोलॉजिस्ट से, तो क्या चांसेस है कि अक्यूट से हमारा जो अर्टिकेरिया है वो क्रॉनिक में शिफ्ट हो जाए या फिर काफी सीरियस एक कंडीशन बन जाए, एंजियोएडेमा जैसा कि आपने बताया, इस तरह के चांसेस भी क्या रहते हैं?
ऐसा कभी द फर्स्ट आई लाइक टू क्लियर द लास्ट पॉइंट कि क्या कंडीशन सीरियस बन जाए एंजियोएडेमा वाली, वो ऐसा रिलेशन कभी नहीं होता. इट इज ईदर एसोसिएटेड अर्टिकेरिया एसोसिएटेड विद एंजियोएडेमा और विदाउट एंजियोएडेमा, राइट? सो आई वुड से कि आपने ट्रीटमेंट नहीं लिया इसकी वजह से आपका कन्वर्ट हो गया एंजियोएडेमा, दैट इज एंटायरली अ डिफरेंट फिनोमेना. ठीक है, वन दैट दिस पॉइंट इज क्लियर. एंड अनदर थिंग इज कि क्या आपका कॉम्प्लिकेशन मतलब आई मीन व्हाट वाज द फर्स्ट क्वेश्चन,
क्या अक्यूट से वो क्रॉनिक अर्टिकेरिया में शिफ्ट हो सकता है अगर हम उसे इग्नोर करते हैं?
If you're not ruling out the cause, you have acute urticaria because of some infection, और बच्चों में जैसे देखा वर्म इन्फेस्टेशन की वजह से अर्टिकेरिया, आप उसको नहीं ट्रीट कर रहे, आप वर्म के लिए दवाई डीवर्मिंग कर ही नहीं रहे हो बच्चे की, या फिर इन्फेक्शन को किसी में ट्रीट कर ही नहीं रहे हो, तो ऑब्वियसली वो 6 वीक से जैसे ही प्रोलॉन्ग करेगा वी विल कॉज इट chronic urticaria. So that's become important. If a patient comes to you after 1.5 months, 6 weeks is 1.5 month around. So if it comes at around 8 weeks or so, we still rule out certain particular causes कि ये कहीं acute urticaria ही हो जिसे हम treat ही ना कर रहे हो. Maybe underlying infection was there or some fever was there and we are not treating it. जैसे बच्चों में मैंने बोला deworming ही नहीं कर रहे हैं, तो उस केस में obviously it prolongs and call it chronic urticaria. वो inevitable से अपने आप बन गया because of duration.
Right. So it's always good to go and consult a qualified dermatologist in case you have these symptoms at the very first place. Now, doctor, we would also like to understand what are the treatment options available for treating urticaria.
Okay, yeah. First and foremost, if it is inducible urticaria, as I told you, solar urticaria, cholinergic urticaria और pressure urticaria, inducible factor को remove कर दीजिए अपनी life से. You have to click the point कि हाँ आपको solar urticaria, see हम sun से बच नहीं सकते हैं, हम जाएंगे but we can take due protection from sun कि अगर आपको solar urticaria है. Plus जैसे हम एक्सरसाइजेस करते हैं, मतलब कॉलिनर्जिक अर्टिकेरिया हो रहा है, तो हमें पता है कि अगर हमारे को हमारी क्वालिटी ऑफ लाइफ कॉलिनर्जिक अर्टिकेरिया की वजह से खराब हो रही है, तो हम एक्सरसाइज का फॉर्म चेंज कर सकते हैं कि ज्यादा स्वेटिंग ना हो, मेडिटेशन या कुछ इस प्रकार का कर सकते हैं। तो ट्रिगरिंग फैक्टर जहां जहां है वो हम रिमूव करते हैं। सबसे पहली बात तो ये है, इफ फूड इज अ ट्रिगरिंग फैक्टर, सर्टेन फूड्स आर ट्रिगरिंग फैक्टर, तो हम उसे रिमूव कर दें। इफ सर्टेन मेडिकेशन इज अ ट्रिगरिंग फैक्टर, जस्ट मेक डाउन अ लिस्ट, जॉट डाउन अ लिस्ट कि ये मेडिकेशन हमें नहीं खानी है और इसका सब्स्टिट्यूट ही हमें लेना है। नाउ we talk, this is the whole management of urticaria, how it is treated. If you have an underlying condition like thyroid or diabetes, get yourself treated first, because that may be the cause of urticaria. Now if you have chronic spontaneous urticaria, I mean no known cause to you, and you want your treatment, then we have certain medications, there is a role of certain medication, there is a proper ladder which is followed. The foremost thing is, first line agents which we use in urticaria are antihistamines. These are anti-allergics. Commonly, जो most common जो घरों में देखने या सुनने ही मिलता है, that is citrazine or levocitrazine. Then there are certain different congeners of antihistaminics, like आजकल first generation antihistamines हैं, second generation है, third generation है. first generation थोड़े sedative होते हैं, तो आजकल हम नहीं यूज करते हैं, जैसे हाइड्रोक्सीजीन या एटारेक्स ले लेना. Then second generation में ऐसा sedation का कोई problem नहीं होता, तो they are fine, we can take them. Then there are third generation, मतलब क्वालिटी ऑफ लाइफ इंप्रूव करना है. अब किसी को क्रॉनिक स्पॉन्टेनियस अर्टिकेरिया और रिकरेंस है, तो हम ऐसी मेडिकेशन नहीं चाहेंगे जो हमें हमेशा सुलाती रहे या सेडेशन में रखे, तो विल गो फॉर हायर गुड like formulations of antihistamines. Then we can add, if अगर हमारा फर्स्ट जनरेशन कोई भी एंटीहिस्टामिन्स हमने ऐड किया और उससे भी रिस्पॉन्स नहीं आ रहा, then we step forward, we can increase the dose to 4 times. This is a proper ladder of treatment, जिसमें अगर हमने एक सिंगल डोज से स्टार्ट किया, then we can increase up till 4 times. Obviously I am telling everything, but it's always should be taken under the proper guidance of your dermatologist, and don't do it at home that हमारे सिट्राजीन हम ले रहे हैं अब 4 गुना ज्यादा करके देख लेते हैं. No, it's not like that every time. आपके डर्माटोलॉजिस्ट pros and cons देख के सब चीजें रूल आउट करके डालेंगे, but till 4 times we can do it. Then also, if you're not getting improvement, then we can add other congeners like prostaglandin inhibitors or montelukast and etc. Monter जैसा हम सुनते हैं, montelukast we can add along with an antihistamines, ताकि अगर कोई prostaglandin या mast cell inhibitor का factor है तो हम वो add करें. Still also you are not getting an improvement, then after doing the 4 times dose of antihistamines, there are certain immunosuppressants which are added. I'll take the name of few immunosuppressants which can be given, like methotrexate. Cyclosporin is a very wonderful drug, but the important point here is that you have to be properly monitored while taking these drugs. These are drugs which are given for a stipulated period of time, like maybe 3 to 4 months, and then taper down gradually. उनको धीरे धीरे करके बंद करना होता है और अंडर प्रॉपर मॉनिटरिंग ही लेना होता है. और आजकल तो मोनोक्लोनल एंटीबॉडीज लाइक ओमालिजुमाब और आ गए हैं, जिसकी वजह से देयर आर सबक्यूटेनियस इंजेक्शंस व्हिच आर गिवन वीकली डोजेस, देन ट्वाइस वीकली, बाई वीकली, एंड एक प्रॉपर मतलब एक पैटर्न में वो दिया जाता है, जिससे काफी हद तक आपका अर्टिकेरिया मैनेज्ड रहता है, कंट्रोल रहता है. बट माय इंपॉर्टेंट थिंग इज एंटीहिस्टामिन्स, तो हम द इंपॉर्टेंट थिंग इज एंटीहिस्टामिन्स तो हम ऐसे ही ले लेते हैं घर पे, चलो लेवोसिट्राजीन खा लिया. उसके बाद के जितने भी ड्रग्स हैं हमें उसमें प्रॉपर मॉनिटरिंग चाहिए रहती है. सो डोंट टेक देम विदाउट द एडवाइस ऑफ योर डॉक्टर, एंड प्लीज टेक ड्यू एडवाइस बिफोर टेकिंग.
And that's why we are continuously emphasizing the fact that you need to go and consult a qualified dermatologist. Don't go for self-medication. Don't go for over-the-counter medication or home remedies. I would also like to talk about home remedies, doctor, because apart from going to the chemist shop, we would love to run inside our kitchen and apply something on our, skin or the rashes.
Yeah.
It's a very general practice. Is it okay to do?
See, that depends what are you using. Sometimes people apply ice over their itchy bumps. That is okay, no problem. आपको relief
aloe vera is again a very common thing.
Yes, थोड़ा ठंडक मिलता है. So topical application, obviously, if you can apply, you can some calamine lotions हमारे घर पे usually होते ही हैं, वो apply कर लेते हैं. That there are some soothing agents. Yes, you can definitely apply them. It's ऐसा नहीं है कि दिस इज स्ट्रिक्ट नो you want to get some relief, आपको ठंडक से relief मिल रहा है या आइस एप्लीकेशन से मिल रहा है या एलोवेरा लगाना, that is okay. Calamine is perfectly fine. Even we prescribe calamine for the acute onsets of urticaria.
पर कुछ ऐसा हम ना लगाए जिससे वो और ज्यादा इरिटेट,
या ऐसा नहीं कि हल्दी लगा के उसको ठीक कर रहे हैं ऐसा नहीं पॉसिबल.
एग्जैक्टली ऐसा कुछ भी करने से पहले प्लीज गो एंड कंसल्ट द क्वालिफाइड.
Ice application, lotions, calamine lotion, soothing agents are perfectly fine. Yeah.
Now we can already imagine, doctor, then how much stress a person who have these urticarial rashes goes through. I mean,
one of the important complication. Yeah.
Yes, I mean कई बार लोग socialize नहीं करते हैं, वो family functions में नहीं जाते हैं because they are continuously itching. So they are in so much of stress. Now what I like to ask is that does this stress is going to aggravate their urticarial condition?
Yes, stress can always be a factor to aggravate urticaria. People are having chronic urticarias and they are manageable under medications, and suddenly they are having emotional stress or any kind of mental stress, which can definitely aggravate urticaria. Stress can always be a factor for aggravation of skin diseases. It's a well-known fact.
So it's a vicious cycle. I mean,
stress it becomes a vicious cycle. That you stress a lot and then you get raised bumps, and then it's like that. It's a vicious cycle.
And many times people who have urticarial rashes complain that their urticaria get worse during night. Why that happens?
See, that is not a proper, there is no as such circadian rhythm related to urticaria कि night में ही ऐसा क्यों हो रहा है, या I mean usually तो I would say कि कई बार late night अगर हम सो रहे होते हैं कि early हमारा जो early onset morning में क्या होता है, early morning तो usually हमारे cortisol levels या steroid levels बहुत अच्छे होते हैं, तो हमें urticaria नहीं होता. So maybe this is not a hard and fast thing that people are getting it at night. It's a individualistic phenomena कि कुछ लोगों को night में आ रहा है. ऐसा generally नहीं होता कि हमें सबको night में ही आता है. So it may be an individual finding. उनका ऐसा observation हो कि उनको night में आ रहा है. So not related to any particular circadian rhythm for urticaria, I would say.
Fair enough. And does urticaria make a person tired?
You're anxious all the time. That's why you feel tired. It's a part, like just like a it's a major complication for urticaria, that you feel tired because you're itching a lot, you're stressing a lot कि redness आ गया, तो उस वजह से you feel tired because you're anxious, you're like palpitations are there and you're sweating a lot कि हमें itching हो गया या जैसे red bumps हो गए, तो that can give you a feeling of tiredness.
Okay, I'll take some of the questions that our viewers are asking. So Anil Parashar's question is, which food should I avoid if I have urticaria? Any dietary precaution?
I told you there is a common list which we see of urticaria. I can't say that this food should not be taken. You have to just testify it according to your diet. जो कॉमन चीजें हैं जो हम रूटीन में खाते हैं, लाइक बेसन, चना की दाल या मटर, मूंगफली या खट्टी चीजें लाइक अचार, नींबू का रस, या बीज वाली कुछ सब्जियां लाइक बैंगन, टमाटर, इन चीजों से कॉमनली देखा जाता है कि अर्टिकेरिया आता है. अगर ऐसा कुछ है तो आप अवॉइड कर सकते हैं. शेलफिश, प्रॉन्स, अगेन सोया, then sometimes dairy products. It's not a hard and fast thing. You have to see what triggers you, not common for everything.
Okay. Tanuja Raman is asking, what laboratory tests are needed for simple chronic urticaria? Do you advise any tests when a patient comes to you?
Yeah, we go for certain tests, like we go for complete blood count with absolute eosinophil count. Then to rule out infections, we go for ESR and CRPs. Sometimes it is chronic, we always go for thyroid test, TSH profile for that patient. And children, I would always say go for urine routine microscopy and stool culture test.
Okay. Sonu Sharma is asking a very important question. Ma'am, क्या urticaria genetic होता है? हो सकता है?
Genetic association is there, but not in every patient. Yes, there are certain HLAs which are associated with genetic causes. We see there is a genetic association, but not in every patient. Yes.
Okay. Pramod Jain का सवाल है, does vitamin D help urticaria?
Sorry, what does vitamin D?
विटामिन डी हेल्प अर्टिकेरिया, मतलब रिलीव करने में कोई मदद विटामिन डी से मिल सकती है?
Vitamin D, not in my knowledge and not in my literature. What I have read as such, कि vitamin D से कुछ मतलब as a medication you are taking, it helps in improving urticaria. Then I would say not in my knowledge. Yes, no.
Okay. Athar Jan is asking, what is the best treatment of resistant chronic urticaria?
Best treatment of resistant chronic urticaria. See, as I told you before, start with a step ladder of antihistamines. You can increase the dose up till 4 times. Then you can add another prostaglandin inhibitors or mast cell inhibitors. If still not improving, then immunosuppressant, but under the guidance of your doctor.
Okay. Now, many a times people complain, especially those who have chronic urticaria, that their treatment is taking so long. वो treatment करवाए ही जा रहे हैं, बहुत lengthy treatment हो गया है, लेकिन पूरी तरह से urticaria जा नहीं रहा, relief तो definitely मिल रहा है. ऐसा ही एक सवाल पूजा पंडित पूछ रही है, will my chronic idiopathic urticaria ever go away?
मैम ऐसा है कि ये chronic idiopathic में मतलब I understand your concern, because yes, there are some times that even medications will continue for a longer period of time, I would say, because now there are certain good immunosuppressants, and as I told you, omalizumab is available. You can go for that if it is not improving with antihistamine. Sometimes cetirizine is not the drug which improves urticaria as such. Sometimes you have to add something more. If it remains stabilized on those medications, then I think you should take them instead of hampering your life or quality of life, right?
Right. And is urticaria contagious, doctor?
No, urticaria is not contagious, not at all.
Okay. Now, initially, you also mentioned that many times due to infection, etc., one can get urticaria. Now, during last 2.5 years, where, COVID was at peak, we have seen many cases where people came and said that, I had hives on my face after I got COVID positive and vice versa. Is there any correlation between COVID and hives?
Yeah, see, COVID was a new thing for each one of us, for everyone, even for all the doctors and the scientific status. Yes, cases have been seen that post-COVID people were getting hives over their body, and suddenly just after COVID, they started feeling the same. Yes, it might be because of the immune modulators which have been changed due to COVID, that people are getting urticaria post-COVID, and it stays for a longer time. But yes, people have improved also post that. But they have taken a longer time. That's the only thing I would say.
Right. Okay. So Neeraj Shah is here asking, ma'am, which molecules you prefer in chronic idiopathic urticaria and which is fast acting? A very technical question, I'll say.
Okay. See, these days, per se, I'm preferring bilastine as a molecule because it is non-sedative, and I'm getting good response as well. So right now, my first choice is bilastine, though it is a new molecule and introduced in the recent times only, but I'm finding very good responses with this molecule.
Okay. Many times it happens, especially with people who have chronic urticaria, that, for example, they have started their, treatment or medication, etc. एक point of time के बाद उनको relief भी मिल रहा है, तो उनको लगता है 2-3 महीने दवाई खा ली है, अब हम बंद कर देते हैं, बिना डॉक्टर से बात किए वो अपनी दवाइयों को बंद कर देते हैं. कुछ दिन बाद फिर से वही symptoms दिखते हैं, तो उनके पास prescription है ही, वो फिर चले जाते हैं, दवाई लेके start कर देते हैं, और इस तरह से on off without even letting the doctor know. वो खुद का ट्रीटमेंट इस तरह से करते हैं. आई एम श्योर यू मस्ट हैव गॉन थ्रू सिमिलर पैटर्न्स.
Many times it happens, yeah.
Yes. So what do you normally advise them?
I would say it's not good to do the same thing every time. Sometimes the trigger might have been different. Sometimes the doctor might advise you a better molecule, better drug for a longer period of time. So it's better to take the advice of your doctor. Once in a while, it's okay. मैं समझती हूँ जिनको क्रॉनिक इडियोपैथिक अर्टिकेरिया वो हर बार ऐसा ही करते हैं, बट हर बार ऐसे नहीं चलता, कभी कभी आपको एडवाइस बीच में एडवाइस लेना जरूरी होता है। समटाइम्स द ट्रिगर माइट बी देयर, और किसी कारण से आपको अब होना शुरू हुआ और वो सब ठीक हो गया, तो क्या पता वो कारण आपके डॉक्टर ही बता सकते हैं आपको।
Right.
Yeah.
And Dr. Kirti, before we sum up the whole session, any take-home message for our viewers?
As you rightly said, consult your doctor without hesitation and take proper advice before starting your own treatment. It's not advisable and it's not good even to remain to silently suffer from urticaria, because it's a treatable condition and your doctor can definitely guide you very well in this manner. Instead of taking OTC or over the counter preparations, meet your doctor and get yourself treated.
Right. There's no point in suffering in silence. And
Yeah.
why should we do that when we have
Yeah.
treatment available?
Yes.
So please go and consult a qualified dermatologist in case you have these symptoms. Thank you so very much, Dr. Kirti Kalra, for your valuable time.
Thank
It
you.
was wonderful hearing you. It was a very informative session indeed. Thank you so very much.
Pleasure is mine. Thank you.
And I'm sure they will, this was a very informative session, and the information will be used to prevent, the viewers will use it to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they now know that instead of self-medication, it's always better to approach a nearby dermatologist. Thank you once again, doctor. We really look forward for many more such sessions in the coming times with you for our viewers.
Okay.
And viewers, thank you for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day.